gone. Peter Bains is Director and Chief Executive Officer at Syngene. He's joining us from Bangalore. Mr. Bains, thank you very much for your time. Good morning. Sir, first of all, could you tell us what you're doing at Syngene? A little bit. I mean,
sure,
let's just start with the basics a little bit. We've got the numbers here.
Sure. Well, I guess behind the numbers, what we're doing at Syngene, I mean, our vision is to become a world-class contract research and manufacturing organization, providing innovative solutions to our very broad global customer base, which is the innovative-based life science market led by pharmaceutical companies and biotech companies. So what we do in Syngene is we provide the underpinning services to them. And our unit of operation is really a world-class team of scientists operating in state-of-the-art laboratories and manufacturing facilities, delivering discovery, development, and manufacturing services with global quality and enjoying the India price advantage. And against that background, we've built a business, I think, which is very robust. I think it's very well placed in the global market. The results that we've delivered in this half, I think, a very, very positive set of results, with revenue growing 28%, EBITDA growing 27%, and PAT growing 29% at the halfway mark for this year. So it is a very robust and strong set of results. And what's particularly pleasing to us is that we're seeing growth across all our major verticals in our business. We have some dedicated centers with long-term strategic clients. That's growing. We have discovery services in discovery chemistry, discovery biology. We're seeing very strong growth there, particularly in biology. And in development and manufacturing, we've seen very, very robust growth this half. And I think we're very pleased with the results as our debut results post our IPO in August, and we look to the second half of the year, quite confidently.
Okay, fair enough. You're called a contract research company, right, Mr. Bains? So tell me, very simply put for our viewers, what does so if a client, a large pharma company, walks in the door and they have work for you, what is the nature of the work? What do they tell you? What do they want? A typical client.
Sure, Prashant. It's a difficult question because actually we offer a very wide range of service support capabilities. But a typical client may come in and want us to support them in chemistry development. They may have an early lead compound which they would like to develop and hopefully take to the market as a medicine one day in the future, maybe 5 or 10 years down the line. But what they may require is a team of chemists to work to optimize that molecule, or a team of biologists to do the same. Or they may require analytical capabilities or stability chambers. So there's a range of underpinning capabilities that are required to discover, to develop, and to manufacture novel pharmaceuticals, novel biologics, novel agrochemical products. And we have a huge team of scientists here in Syngene, over 2,000 scientists. It's in fact the largest team of scientists in India now. And our scientists will support our clients in advancing their assets through this discovery, development, and manufacturing continuum.
Are these 2,000 scientists employees with Syngene, or they're also essentially on contract? As a project comes up, you take them on board and...
No, these are Syngene employees, and we will look at the scientists will be allocated to clients, and they'll work with those clients through the life of that project.
And how do you get paid? Do you get paid on some threshold of success predefined between you and the client, or you get paid some amount irrespective?
Well, yes, we have two fundamental models for payment. One would be what we would call a fee for service, where the client, in consultation with Syngene, would lay out what work needs to be done, and there'd be an agreed fee, and that could be staged depending on the progress of the product. And the other common model would be what we call a full-time equivalent model, where a customer or a partner would want a team of scientists for a year or 2 years to work on a certain project or initiative, and we would get paid by the number of scientists that are allocated to that project. Now, we do include, as you've suggested, some projects where there would be milestone payments or success payments. But the two basic models would be the fee-for-service model or the full-time equivalent model.
Right, right. And the reason why the client would basically go through you to get on board a certain number of scientists to work on a project or a molecule is because you've got the facilities for these scientists to work in, right? I mean, the physical infrastructure. Unlike, so yeah, that's essentially the advantage that you have.
Yes, I mean, a prospective client would come to Syngene and they would look at both the facilities that we have, and we now have over 1 million square feet on the campus here in Bangalore of state-of-the-art laboratories and manufacturing facilities. And they'd also get the opportunity to talk to our scientists. And I think they would, through that, through that, both the visualization of the capabilities that we have in our infrastructure and the quality of our scientists, and they'd look to work with us.
How many clients, how many projects, in a way, if I can use the word projects, or are you working on at this point?
The number of projects, if you break it down, would be in the thousands. The number of customers that we serve is just over 200, but many of our customers have multiple projects that we're working on them with. So I haven't got the precise number, but the number of projects we're working on would run into thousands.
200 customers, thousands of projects. Okay, fair enough. What would be, is there any sense in breaking it down into the average size of the contract, value terms?
I mean, we can look at that, but there's really a very, very broad spectrum here. So we work at the very small scale. So take, for example, a virtual biotech company. We could work with them on a very sort of small, narrow and focused basis where we might have 2 or 3 scientists working over a period of a year. And that would extend all the way through to, I think, the collaboration that we have on a dedicated center basis with Bristol Myers Squibb, where we have over 400 scientists working for them on a long-term strategic contract. So the scale of engagement can vary quite considerably. Of course, most of the contracts and customers that we serve are somewhere in the middle, but that serves to illustrate the range and perhaps where the average may lie.
All right, fair enough. We'll leave it there. Mr. Bains, thank you very much. Good show, but I think we got some fundamental, basic things out of the way. Great speaking with you. Good luck, sir.
Thank you, Prasad. Thank you, Prasad.
Thanks very much.